6:25, it's time for this morning's Family First, and we're revisiting a topic that we've discussed back in early spring, emergency room hesitancy, especially during the pandemic, something you may still feel to some degree a little bit nervous to do, especially when it comes to taking your kids to the hospital.
Yeah, so Fox 61's Maggie Sliz is checking in with Connecticut Children's Medical Center for an update and also some thoughts on the winter months ahead. Hey, Maggie.
Hey guys, good morning. Yeah, perhaps you've seen these public service announcements, commercials, maybe you've spotted the billboards along our highways. Hospitals trying to get the message across that they are open, safe, and ready to help those who need it. All this an ongoing effort as some parents may still feel extra uneasy about bringing their child to the emergency room. When the pandemic first hit our state, perhaps ironically, pediatric emergency rooms saw patient volumes drop.
Because of the nature of the virus and the infection, with children being somewhat less commonly infected and certainly being less seriously infected, we had a very dramatic drop in our patient volume in the spring.
Dr. John Brancato is the Associate Director of Emergency Medicine at Connecticut Children's Medical Center. He says that an average day at the hospital brings in roughly 175 patients, and this fluctuates with seasonality, especially in pediatrics. But back in April, on their slowest day, that number dropped to below 40. So where do things stand now?
As school has started, our volume has continued to slowly climb. There's a small increase in the COVID infection rate in the state, but it's nothing where it was in the spring because we're doing all the right things by and large.
Dr. Brancato says numbers are closer to their normal range now, but low acuity volume is still down in the emergency room. That includes visits for things like rashes, stomach aches, ear infections.
During the COVID period, some of this emergency department hesitancy led some people to be so afraid of coming into the emergency department that their children waited long enough for their evaluations that they ended up being probably a little bit sicker than we would have otherwise expected.
Something he urges parents and caregivers to really think about if they're still hesitant about emergency room visits.
I want as much as I can to reassure parents that if their child needs attention, medical attention, they can feel comfortable bringing them in. We've done multiple things to keep the children, their families, our staff all safe.
He reminds parents that the hospital also has an urgent care facility in Farmington.
That's a kind of a quick and lower volume place to be seen for low acuity.
He wants to put to rest a concern some parents may still have about whether testing for COVID-19 can delay medical care for children.
It's very important that we be clear with parents that there is never a delay in inappropriate care because of the lack of knowledge of a COVID result. We know that any patient could have it, and we never want to be in a position, and we are not in a position to ever withhold appropriate care for that concern.
As the colder weather approaches, he urges everyone to keep doing what they're doing because it's working.
Because we've managed it well in the past, if we get to a point where the volumes are rising, we will make further adjustments to help blunt that rise. So I do not expect a wave to be quite as bad at all in the state as it was in the spring. I'm an optimist.
Like to hear that little bit of optimism.
Yep, still to come here on the Fox